Here we go. We're recording. All right, so we're going to go over the multiple choice portion of our study guide. Number 1 is B. 2 is C. Okay, somebody's TV's going. Y'all got to mute me if your TV's going. There we go. Okay, number 2 is C. Number 3.
You said B?
Number 1 is B.
Okay.
Number 2 is C. Number 3 is D. Number 4 is A. Number 5 is B. Number 6 is D. Number 7 is C. Number 8 is D. Number 9 is D. Number 10 is A. Oh, I'm just gonna throw it on for it. Number 11 is A. Number 12 is D. Number 13 is C. Number 14 is A. And number 15 is B.
I missed number 12.
I missed a few, but I think it was because I overlooked it.
Okay, well, that's fine. I mean, that sometimes when you're reading those straightforward and problem focused, they get kind of bundled together, so y'all are okay. I want to talk about 16 through 20. Do you guys know what a body area is versus an organ system?
Yep.
Okay.
Yes.
So number 16 is the neck, and it's a body area. Number 17 is skin, and it's an organ system. It's the integumentary system. Number 18 is eyes. It's B, an organ system. I got that one wrong, y'all. I just want to be perfectly honest. I just didn't think that.
Oh, I got it as a body.
No, it's an organ system. I did too, Miss Lisa. I didn't think about it like that.
No.
Number 19, the back is a body area.
Right.
And then number 20, respiratory is an organ system.
Gotcha.
Yeah, that's right. I looked under that chart that they had in the chapter. That had it like the body area and then the organ systems. I looked underneath there.
Yep. Well, okay. So now we're going to start our completion portion of things. And this is, I think, the most of our work. So number 21, the term used to describe a patient who has not been formally admitted is what?
Outpatient.
It's an outpatient. Penny, I can see you from here up. Look. And Jade, I can't see your pretty face. Okay. There her is. I like that better. I know I can't make you show your face, but oh, here comes Andrika.
Tell her hello.
Andrika, you there?
Okay, my sound went out, so I can't hear you anymore. I'm gonna get out and come back.
Okay.
Oh, her sound went out.
Hi, Andrika.
Hey.
Are you in the break room at work?
I'm waiting on my HR.
Oh.
Oh, hi.
Okay, so we're just actually, Andrika, all we're doing is we're going over our review, but I'm taping this, so what you didn't hear at the beginning, you can just go back and listen to later, okay? Here comes the data, she's coming back. Okay, so number 22. The answer is 99282. Did anybody get that wrong?
What number are we on?
Number 22 is 99282.
Okay. I got it right, but for some reason I forgot to write the 2 in there. Oops.
So give me a thumbs up if you don't have your sound on and you got it right.
Is my sound still on?
Jill, did you ask that question?
Yeah, I was making sure my sound was still working because
you're working.
This Zoom messes up.
Yeah, you're good. Okay, so we're good with 99282. All right. So number 23 is 99242.
Oh, I got that one wrong.
Okay, well, let's talk about it. The
I
first
put
one. Okay.
99213.
I put 99202.
Okay. Well, let's just talk about it. Okay. Well, this is while we're going over this. Miss Lisa said, who got it? Give me a thumbs up who got it right and a thumbs up who got it down. Wrong. Shoot. I can't tell.
Me.
Sid, were you good with it? Okay, you're good. Okay, so we're going to talk about it. Okay, it says this patient is seen in the clinic at the request. Y'all see that word request?
Of another doctor.
Of another doctor, right? The request of Dr. Jones. So what does that tell us that we are?
Consulting.
We are a consultation.
Oh,
Even though it didn't say plainly, this is a consultation. It's not always going to. You have to look for those little key components. So because it was the request of Dr. Jones, it is a consultation. So we need to be in the consult part of our CPT. I'm going to hold this up in hopes that y'all can see what I've done. I actually have my stuff labeled. So all I have to do is flip over to consult and see I have it labeled with a little label there. I do that because when I want to know what I'm looking, or when I know what I'm looking for, I want to just be able to flip right there and not have to flip through everything. Also, you guys, you have a little table of contents or glossary or whatever on page, I think it starts on page 1, that if you want to go look, it'll tell you what page if you don't want to label. Okay, so let's continue on. So let's go to our PE, because we figured out when we read all that information, we didn't need all that information to figure out our CPT code, because we're just looking for what procedure, which means what evaluation and management code. So when we go to PE, we see that, as I read through, it's expanded problem focused exam. So that's our E right there, correct?
Mm-hmm.
And then we keep moving and it's our MDM is straightforward. So when we go to consultations, and with consultations, it's new or established patient. What am I looking for? I'm looking for my straightforward.
What page is the consultations on?
Starts on 19.
Page 19. And a problem-focused history, exam, and straightforward decision-making. Well, it's not problem-focused, is it? It says it's expanded, right? So we need expanded. So it's 99242. Do you guys see that on number 23?
I see
On the
it.
bottom left on page 20.
I see it.
Okay, do you understand why that's the answer?
Yep, I need to study the the knowing which one to go to.
Right, well, it's not always going to give you the exact wording. It's not going to say, hey, this is a consultation. You have to look for some of those key words. Here's the good news, is very rarely as a coder are you going to have to pick E&M codes. Almost always the doctors picks those for you, but you want to be able to catch if the doctor's making a mistake and can get more money, right?
Right.
Right.
So you have to know the general information in order for you to be able to catch when he's making a mistake or catch when he can get more money. So, and I love labeling these each chapter in my CPT, because I don't have to worry. If I know that I'm in the integumentary system and I know that I want to go to the nose or I want to go to the face, or I know where I'm going. That's why I do all this extra labeling. It saves me time. It makes me feel secure and comfortable with what I'm doing. Okay, so let's go ahead.
So you labeled it like CE.
Yeah, I labeled it in each one of the little dots, but I also labeled my sections. So if I know that it's a consultation, I have a little tab. Let me show it again, Jill. Right here, I don't know if you can see it. Well, my little tab says consult, so I can move right to it.
Oh, okay. You bought little tabs to put at the top.
Girl, I'm the tab queen. I got them in all colors and all designs. I love my tabs. I tab everything. Don't I, Sydney? If you sit still long enough, I might just tab you. All right, so let's move on to 24. The answer is 99201. Jill, how'd you do?
I got that one right.
All right, we're good to keep moving on. Penny, we good? Okay. Number 25 is 99205. We're good?
Good.
Okay. I want to just put a little extra information. Anytime that you code a code that has a 5 on the end of it, which is the most extreme cases, you are always going to have to attach medical records to it if you're billing and coding before you send it to the insurance company, because they want to know why you're charging the highest codes you can charge, which means we get the most money. Before they give you the most money, they want to make sure it's a 5. That's just for your information kind of stuff. Not that you're going to be quizzed on it, but okay, number 26 is 99253. Okay, all right, so let's talk about it, Anjada. An initial inpatient consultation. So where do we need to be? In consult, right?
Page 19.
Yep, we had a detailed
Yeah, I know where I
history.
went wrong. I went to initial something.
Yeah, well, it's an initial inpatient consult. And remember, in consults, we can have established or new patient, but it's still a consultation. So anybody else need further explanation on that one?
Can you say
No.
the code again?
I went to the inpatient section too instead of just going to straight to the consultation.
Okay, it's 99253. All right, so number 27 is 99396. Where did we go for this one? We went to preventative care, didn't we? Y'all,
Yeah.
if you don't mark anything else in your CPTs in the E&M section, mark your preventative medicine, because when I start searching for that, I can never find it. So I have it marked. It's just going to save you so much time.
Okay. I need to tab mine anyway. I think the tabbing would be better. I just highlighted a lot of stuff.
The preventative, I just went to page 37.
Yeah, it's on page 37, the preventative. And in preventative, be careful, because you do have preventative new patient and preventative established patient. You have to know whether we're new or established. That's where you're going to get your right codes from. So 27 is 99396. Okay, number 28, 99460. So where were we going? We're going to that newborn section, right?
Yes, ma'am.
Yes, ma'am.
And then you have a lot to do in the newborn. You can have neonatal intensive care for newborns and just regular newborn too.
For this one, I got confused. I kind of just picked the one that I thought was best. I don't know. I asked you the question later because I need to label my book so I can get there faster. It's gonna take a while.
The newborn is on page 45, Anjada. History and exam of a normal newborn infant born in a hospital setting. So let's read 99460. Initial hospital. Go ahead. I'm sorry, Anjada. Go ahead.
Because it said initial. I mean the normal limits. I didn't know what's normal because it didn't say nothing else. So that's why it's just the first code.
Right, but when we read the first code, it says initial hospital or birthing center care per day for evaluation and management of a normal newborn infant. And Jada says, okay, Miss Marcia. All right, so let's move on to number 29. The answer is going to be 99214.
Because she's established.
That's right. She's an established patient. detailed history, detailed exam, and medical decision making was moderate. So we had a DDM. So if you labeled your CPT the way I said, you would just go to establish and look for DDM 99214. So how many of us got that right? Thumbs up if we got it right.
Me.
Sid, were you
And
good?
she's over the age of 5 too.
All right, so number 30, the one thing that I want y'all to be careful of, when you read these scenarios or when you see them and there's a lot of words, please do not get scared, because you're only looking for specific things in those words. I mean, that's a whole page. Miss Deb, I'm on a Zoom call. Here comes Miss Deb, y'all. Hang on a second. I found my teeth. She found her teeth and she has to come show us.
Y'all know I'm obsessed with teeth. How cute is that? It's salt and pepper shakers in their teeth. It's like a denture.
Oh, awesome.
We found that at the flea market in
Can y'all
Ball.
see it?
Oh, and Bob, of course.
This is Miss Deb. She's my partner in crime.
Oh, so beautiful. I love to see students.
I know. We miss them. We ready for them to come up here driving us crazy.
All right, y'all enjoy your Zoom call.
All right. So what I was saying before my partner over here decided to get us into teeth instead of our CPT. When you see lots and lots and lots of words, I know you tend to want to get nervous and you're like, man, I don't want to read all of this. But whenever I was coding as a cardiology coder, you have to understand, when I needed to code hospital procedures and things like that, there would be pages and pages and pages. What you learn as you're doing that job is you don't need all those pages. Your eye will start going to exactly what you need, where you need it. So I don't want y'all to get scared when you see all these words, okay? So the answer is 99233. First of all, I want to see who got it right.
Oh, I got that one wrong.
Okay, well, we're going to talk about it. Okay, so what I found in this is it didn't give us a lot of information, did it? The only thing that it really gave us is our medical decision making is of high complexity.
And I underlined that.
Right, so that's something that we had to abstract out of there, that, you know, it's of high complexity. So this patient is continuing on CAPD. Her weight is fluctuated, but this is where I want us to go. Right on that third line, over the last day or so, she has had problems with hypotension related to perhaps initially bradycardia, which is a what? It's a slow heartbeat. Do you know how you remember bradycardia? Brady women are slow.
Slow.
Like the Brady Bunch? I don't know. Yeah. That's how they taught me in the hospital, so that's how I remember it. So it was a slow heartbeat. Huh. So as we keep going down there, we're just reading all this stuff about her, and because we're not looking for her diagnoses, we're just looking for what they've done, correct?
Right.
Right.
Can they hear me in that break room, Andrika? Andrika Eldridge. Okay. So let's look at her management plan. The management plan at this time is to discuss, can they hear me in that break room, Andrika? No. Oh, she has earbuds in. I was just making sure. Okay, we're going to discuss a different drug management plan with cardiology to see whether or not she is a candidate for a class 3 drug in view of the patient's intolerance to these medications. She may well tolerate dioxin at a lower dose, but the problem is not effectively blocking her ventricular response. So when we read that, we start thinking, well, how do we know if that's bad or not? Anything to do with the heart and medications not working is of a little bit higher complexity. Like, you're not going to say, no big deal. No, this gets your attention. Your red flags start going up. The other component of her management will be to interrupt the antibiotics and observe her. And then thirdly, she will be getting a...
You got it. We got it.
Esophagus.
Go ahead.
That word that is that long, that word. I could do it if I did it on the board, but I'm not doing it on the board. Today, and a CT for her abdomen tomorrow to try to investigate the true core problem that she has. Finally, we are going to increase her blah, 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 blah with all of that, and we'll maintain blood pressure and organ perfusion a little bit higher. This illness is still what? Serious.
Serious.
She is not thriving. She is not eating well, and her prognosis at this point is still extremely guarded. And so the MDM is what? High.
High complexity.
Of high complexity. So what we have to decide is, where are we going in E&M? She's in the hospital, right? So she's a hospital inpatient. This is one of the days. This is a progress note. Well, it says up here, location, the hospital. This progress note is the doctor just going in to talk to her, you know, when you're in the hospital. So this is a subsequent hospital care, because we're not admitting her. So it's not initial, it's subsequent. She's been in the hospital. And so which of our subsequent hospital cares has a high level of decision making?
Detailed.
It's all detailed. Even though it did not tell us detailed, we can read and we can look at how much information we have and know that it's detailed. So 99233 is the answer because of the high complexity. Does that make sense? Or am I yammering for nothing? Did that help at all?
That makes sense. I just, again, need to study the different locations.
Well, I mean,
I
you
went to
know,
the
if your
initial
teacher wouldn't
consultation.
have rushed you through this because she did not write the right day down for the end of the module, you may feel a little better. But we're going to get there. We're going to get there. Okay, so let's go to 31. Again, where's our location at?
Inpatient hospital.
Okay. She's getting dialysis. She's getting all of these things done. If we look at the last little line before our answer line, it says dialysis plan today. And the medical decision making is what? Moderate. So
Moderate.
it's inpatient. She's already been seen. So we're subsequent hospital care and we're moderate. So what's our answer?
99232. Expanded problem with moderate complexity.
The answer is 99232. I want to ask you.
Overlooking a couple of things.
Right. Well, sometimes this initial hospital care and subsequent hospital care can be tricky. Initial means right then, correct?
Yes.
So initially admitted to the hospital, that's your initial cares right there. That's when you're being admitted, correct? When you get to the floor and that doctor admits you and you're initially being cared for, that's your initial hospital care. That's the first time under inpatient. Every day after that is subsequent.
Okay.
When you read the first line, it says this patient was reasonably stable, what? Overnight.
Overnight.
So she's already had her initial day. She was overnight. This is the next day. You're having to just abstract those words a little bit here and there, okay? All right, so the answer to 31 is 99232. The answer to 32, now, patient presents for routine examination. That's what our CC is. So with routine examination, where are we going to go?
Clinical?
No, we're preventative care.
Oh, yeah, preventive.
Well, for some reason, I had skipped that one. I didn't mean to.
It's okay. But the answer is gonna be 99396. Because she's 42 years old. Those you have to watch the age.
Okay.
Okay.
Okay, I'm gonna have to go a little, oh, well, I don't have to go real fast because, oh, wait. Here we go. My pages are out of order, y'all. Okay, I'm gonna have to speed up because we only have 10 minutes left.
Okay.
Oh,
So number 33 is 99213. So how did
Could we go
on that
backwards?
one?
Could we do the matching 41 through 50 since they
Yeah,
wouldn't
I
take
promise.
that long?
Yeah, I'm gonna make sure you get that before we get off, I promise. We're just gonna go through and let me just give you the answers to these coding, and we'll go back if we have time. So number 33 is 99213. Number 34 is 99212. Number 35 is 99341. Number 36 is a code range. It's 99341 through 99350. Number 37 is chief complaint, or CC. Number 38 is modifier 25.
dash 25.
Yes, ma'am. Number 39 is 99282. I thought it was a 99281. I'm just saying, but the answers say 99282. So either way. Then number 40 is 99231. Okay, so 41, we're going some matching now. This is the order, 41 through 47. C, F, A, G, B, E, D.
You said E, D?
Yeah, 46 is E,
Okay.
47 is D. Y'all,
Gotcha.
I got 44 and 45 mixed around, but when I did the test. So, but it's C, F, A, G, B, E, D. Then 48, 49, and 50, A, D, B.
ADC.
A, D, B.
Oh.
You said C as in cat or B as in boy?
Number 50 is B as in boy. Okay, so are there any coding problems? Because we have about 6 minutes now. Are there any coding problems that you want to go back and look over? Okay, let me ask you this. Everybody's going to need to answer. Who is ready to take a test tomorrow?
Somewhat.
Can we get one more day? If not, then
Yes, we can get one more day of practice. Absolutely. I'm so
totally
sorry,
agree with
Sal.
that.
I am so sorry that I got that date off. I don't, and it wasn't even like I didn't know. I had the email printed out sitting here and I just didn't. Okay, so what I'm going to do is instead of doing a test tomorrow, I'm going to do some more exercises that will help you
Okay.
in studying. But I want you to hang on to this because this is your ultimate study guide, okay?
Okay.
can you do one of the chart like 33 or 34?
33? Okay, so number 33,
Well,
chart
no,
note.
do 33.
Do 33, okay. So it's dizziness, right? Girl, everybody that comes in is dizzy and weak. We may take that as a big deal, but almost everybody, especially in cardiology clinics, everybody's dizzy and weak. They so weak, they so dizzy, they so nauseated. Those are things that you're gonna, when you see, you're gonna realize that is low complexity. That is not something that that they consider to be very serious. Now, if it's dizziness with chest pain, well, what's that? That changes dizziness, right? So
Yep.
this is a 46-year-old female, and she's a what? She's an established patient. And she's presenting today. It didn't say presenting to the hospital, so we're going to assume that it's the clinic, because if it doesn't say hospital, it's clinic. So she has a sore throat. Her throat is sticky, whatever that means. And she has a past history of hypothyroidism and all these different things. But again, it's all normal within range stuff. So the only thing that they gave us was that the medical decision making was what? Low. So we know she's an established patient, so we have to go to our clinic setting and we have to go to established patient. Okay.
I see what I did. I skipped over where it was low and just went ahead and wrote straightforward medical decision and went with 212.
But when you read, 2 of these key components must be present when you're coding. That is true if you don't know where you're going. But here we're very, very clearly told that she's an established patient. Bless you.
Sorry.
Okay, so let's do number 34. This established patient presents to the office today. So where is she? She's an established patient and she's presenting to the office. So, and her medical decision making was straightforward. So again, we're established patient in the clinic, straightforward decision making, which makes it a what? 99212.
Yep. PPS.
Right. Or PPS. See it?
Did you mean to lock the lab? Your little assignment on here, it's locked. It says it was due yesterday at 7 p.m.
Yeah,
Well,
'cause
first of all,
I kind of seen that late.
Well, it didn't have anything on it to click.
right.
Yeah.
Well, Edmodo deleted it, so I went back and put it on there. So I'll have to go back and refix it.
I just wanted to make sure you knew.
Right. Well, I will fix it so it will unlock. Or what I'll probably just do is I'll just post it like in a regular post, and y'all just do it under the regular post. Did all of y'all get to go look at that exercise?
You talking about the one you did last night?
Yeah. Well, it was the cute little pictures with the little scenarios.
I went on at 4 this morning. It wasn't
Oh,
on.
yeah.
I saw that because you messaged me on Edmodo and said there's nothing here. I was like, oh no. Drinking my coffee this morning, I saw it.
Can you put back on the last page of the study guide? Because for some reason, it didn't print out with the rest of my pages.
Oh, you mean like this page? This page?
Yeah, like the last page of the study guide, like 41 through 50. Because it printed all the rest of them.
Well, what I'll do is I'll take a picture of it and text it to you.
Okay.
Okay, do you have any more time? Can you say 21 through 22 like really fast?
Girl.
I had an important call, sorry.
Okay. 21 is outpatient. And Jody, you got to get me off the Price is Right, girl.
Because we ain't winning no money.
Okay, 21 is outpatient. 22 is 99282. 23 is 99242.
11 through 20.
11 through 20. Okay. 11A, 12D, 13C,